I would like to ask the Minister for Health and Social Care how many patients are being treated by the Child and Adolescent Mental Health Service, how many are awaiting an initial assessment, and what the waiting time is for an appointment.
The Minister to reply.
Thank you, Mr President. On the 30th of June 2019, there were 847 people with cases open to the Child and Adolescent Mental Health Service. As of the 10th of July 2019, there were 59 young people awaiting an initial assessment. Of these, 12 are waiting for an appointment. The target time for this is 7 days from referral, and there is one child who has exceeded the maximum wait by 1 day. The remaining 47 have had an appointment and are awaiting the assessment. The target time for this is 92 days. Again, there is one child who has exceeded the maximum wait by 1 day. Target initial assessment waiting times are 92 days as of the 10th of July. The longest wait has been 93 days.
Supplementary. Caine.
Thank you, Mr President, and thank the Minister. Given his answer a year ago, there would seem to be more cases now coming under CAMS. It's really just to get the Minister's impression. Is the service adequate? Is it meeting the demand? And also, in terms of urgent cases, I'm having another flurry of emails this morning from parents expressing the view that their children are not getting seen within the minimum waiting times. One's having waited 20 weeks, more than 100 days in some cases. So what's the longest time people have to wait for treatment? Also, people getting an appointment and then being discharged from future treatment because their child wasn't self-harming and no additional support being offered from the department. So is the service adequately provisioned for the demand?
Minister.
Thank you, Mr President. In relation to that, there is currently a review of waiting times ongoing within the section. One of the things that the Honourable Member's just referred to is the rising numbers, and I do need to point out exactly what I pointed out roughly around about a year ago when I stood up, I think it was in this Honourable Court rather than another place, is that, of course, we've got to remember that at the moment the autism pathways as such are contained within CAMS and they need to be broken out. So although the numbers sound relatively scary when you give the overall figure, it does include an absolute mix of children, some suffering with autism, with behavioural disorders and things like that. So that does need to be, again, I can confirm that in fact actually there was a slight decrease in referrals last year. We went down from 595 in 2018 to 584. There is additional resource being looked at for the service, but there was at one point about 7 or 8 months ago a backlog of cases in relation to the NDD clinic. So there was cases there where certain children were waiting up to 12 months. That has now been resolved and we're back to what I would term normal service. In relation to the urgent cases, I have spoken to several parents as well, but while with the parents, obviously every parent deems their case to be urgent, when I've looked into some of those cases, the actual referral has not been marked as urgent. So they've gone onto the general waiting list. So when we talk about urgent cases, certainly, any parent would think their case is urgent. If they believe that case, they do need to push for the referral itself to be classified as urgent, because I'm aware of cases where that hasn't happened.
Mr. Speaker.
Thank you. Two parts to my question, if that's okay, Mr. President. Firstly, how does the Minister's 92 days standard waiting time or expected waiting time compare to other jurisdictions that we're used to comparing ourselves with? And the second one is with regards to urgent cases. We still are seeing worrying amounts of people taking their own lives in this island, and I just want to make sure that the process for marking people as urgent, that these aren't cases that are being missed, and whether the Minister is keeping a close eye specifically on these cases that are being flagged.
Reply, sir.
Yeah, thank you, Mr. President. I thank the Speaker for that very helpful question. In relation to cases coming into the service, they are all triaged. So I think I've explained in the Honourable Court before about the different scales. That is taken exceptionally serious, and obviously anyone who is seen as being a serious case of self-harm or in fact the extreme of suicide, they are dealt with very quickly. In fact, I've been informed this morning by the section that in those such cases the person would be seen within days, and we have had cases where people have been seen within 24 hours in order because they've been assessed at that high level. In relation to benchmarking across other jurisdictions, we do look at that. So the information I can give the speaker at this session, Mr. President, is if you refer, for instance, to Scotland, their standard is for 90% of young people to start treatment within 18 weeks of referral. At the moment, they're against that target. They've got 73.6% being seen within 18 weeks.
Honourable Member Mr Baker.
Thank you very much, Mr. President. The Minister's, the question, the Minister's answer very much focused on the treatment of child and adolescent mental health issues. And in other contexts, the Minister has previously emphasised his passion and the importance of prevention as opposed to treatment. And of course, the understanding of the root causes of the symptoms that have been experienced. So is the Minister satisfied that there's sufficient work being done in those areas of prevention and root cause analysis, and if not, how does he see that we should move forward?
Minister.
Thank you, Mr. President. That's exactly why we have a review of the service ongoing. The Honourable Member for Aaron Michael, Mr. Baker, again, Honourable Members, the old phrase is prevention is better than cure, and I fully believe that. I think in relation to that, it involves us working with the Department of Education, within the schools about children's mental health, and that work has been ongoing, but we have got a full review of the service. As I say, the headline figures, when you look at the numbers, are quite frightening, but again, I've got to emphasise that includes a wide range of children, everything from behavioural disorders to attention deficit to autism. So it's not purely, we shouldn't take the numbers and think that means we've got some form of mental health crisis amongst children. That is most certainly not the case. So I think the key message is that the service is under review. Prevention has to form part of that, because in the long run, if we are going to actually provide a service that is suitable for the children of the Isle of Man, then and with the advent of social media and everything these days, that prevention and teaching children how to cope with the mental strains that come on them in this day and age is absolutely crucial.
Final supplementary, Miss August Hanson.
Thank you, Mr. President. Can I ask the Minister, not to suggest that they don't do a fantastic and very important job, I'm sure they absolutely do, but when was the last assessment of the effectiveness of the crisis team? Thank you.
Minister.
Thank you, Mr. President. We keep things like the crisis team under constant review. If the member is referring to when there was an overall assessment of the crisis team specifically itself, I will have to look at that information. I obviously haven't got that with me. But in relation to children's mental health, which is what the question is about, and children in crisis, as I gave in the answer before, there are cases where children have been seen exceptionally quickly, and it is treated as an urgency depending on how the case is triaged.